Now, especially when we talk about, we see there have been so many funds. For example, we were talking to SIDBI, we were talking to some other venture capitals like Chirate to create a 6,000 crore fund for Andhra Pradesh. While I was in EY, we helped UP government. We were advising them that why can't UP government have a startup fund of 5,000 crores. Similarly, we need to think about specific fund for AI fund only to think about oncology, wherein what we are saying is like some name it Arogya Tech Fund or maybe some other fund that you want to talk about. But then we make some simplest kind of things. Can we support startups? Can we provide this money from this fund to startups which can really do early detection of cancers, maybe a skin cancer, maybe a mouth cancer, because we see these are primary kind of very many cancers which can be through apps and through by we have a lot of data to train so that we can actually get a right kind of detection. If they are detected earlier, we can probably have chances to save people. So we can think of that. So early detections that can help in from that perspective. Secondly, while we are talking about the first pillar itself, we need to talk to policymakers to not only think about these kind of information. Like for example, we did an event sometime back in Andhra Pradesh, wherein what we did is like we had the entire data of a small city called Kuder. It actually comes under Anantapur, and wherein we were able to talk about, we had all the maternity data, and with that we were able to tell that identify clusters, and we were able to tell that hey, which parts or which particular small sections when women are suffering from sickle cell anemia, what are the areas wherein people are suffering from AIDS. So when you are aware of what kind of problems are coming, what kinds of clusters, what kind of segments are emerging, you would be able to provide that special care that is needed in that area. So similarly, we need to think from cancer also in a similar perspective, wherein we say that hey, the policymaker should think about this fund, how to regulate it, how to identify startups, how to create a policy in and around, so that every section of this ecosystem, which is thinking about curing cancer, identifying cancer, can be worked on. The second thing that we were talking about is prepare a integrated roadmap. Now that we see that we have over the past 7 years, we have significantly seen India's might into startups, and where what we need to see is like not only come up with uh, clear guidelines in terms of policy, but we also did some time back working with CII, and wherein they were looking that India needs more and more medical parks. And at that point in time, in that paper, I told them that if one med tech park is working on one problem, the other should work on another, third should work on something else. In the same way, what we would need is like when we are having different kind of startups, we would want departments that Rajasthan as a state is probably looking at certain kind of things. Andhra Pradesh is looking at some other kind of things. Probably Himachal and Andhra can play, or Hyderabad can play a role in terms of drugs discovery, which is related to oncology. Uh, some other state wherein we see that where if we can see Bihar, where you see still have some part of working people still working in asbestos factories, or in Haryana, they can identify that as a thing, and we identify these different kind of policies, the different kind of mechanisms, and wherein we exchange data in terms of how certain we need not compete. We are a big country wherein we need not every state need not do everything, but we can how we can exchange data not only at a government level but also at a state level. What we can do, we would also need to see how this entire change of startups, and this all has to be done wherein we have doctors taking decisions. We have to involve all clinical persons, those who are able or capable or treating people, to identify that and be part of those advisory bodies, those who are working here. Furthermore, what we are also seeing is like like we had seen in the time of Corona, that how fast the doctor community was actually coming up and sharing in the information that this variant has come, so and so has been observed. If we can similar kind of bodies, if we can identify for different kind of oncological things, wherein we are interfacing with policymakers, we are interfacing with different state level funding agencies and doctors. They say we see this kind of 80-20 kind of a rule, wherein we see that we are facing or we are seeing this kind of a cancer, and we need to see this kind of certain kind of progress that we need to make. So we need to have clinical presence of doctors at all these bodies, and think and make them the first user of the tools that these startups provide. Whether they should be able to give this feedback to these startups that we would like to use your tools, we would like to use your things, but are they really working? Are they really efficient? because from a population perspective also, when we have such a big population across and we have such a big problem in hand, then in that case these kind of real-time feedbacks are really going to help them to identify what needs to be done, a better solution to be designed. So we see that, I don't know if you have seen or if you're aware of UK. In UK, if you're a GP, general practitioner, and if you are actually taking some extra responsibilities, so then there is an incentive system wherein the government pays you more to take care of certain kind of things. So I guess we need to, this is a time to think about that kind of policies also, that if a doctor is thinking that, hey, I need to serve rural, I need to serve oncology, I need to see certain kind of feedbacks or committees I need to sit in, wherein I'm improving certain kind of things which will help India. So from that perspective, we need to think about those policies as well, that will benefit doctors more and will allow them to give a fair share of their time for development of tools, AI tools for doing certain kind of procedures, giving feedback to startups, so that the entire ecosystem over next few years can be created.